her goal was that she really wanted to be able to say to her family that she loved them, or to be able to say, I love you. And no matter how many times we practiced that phrase over and over, she was still really struggling to get it out. And then one day we were doing a little bit of music therapy and we were playing the song, You Are My Sunshine. And when we got to the part, You'll Never Know, Dear, How Much I Love You, suddenly she was able to say, love you. And it can be a really nice way to unlock those little words for people sometimes when they're otherwise really, really struggling. So those are, I suppose, top 3 things to think about would be, functional work, repetition and music.
Hello and welcome back to the Stroke Matters podcast. This series is brought to you by the Stroke Link Nurse Service in the Mater Hospital. I'm Melissa Gannon.
And I'm Lauren McDonough.
With over 40 years nursing experience combined and currently working as Stroke Link nurses in the Mater Hospital Dublin, we have a strong passion for stroke prevention.
On today's podcast, we'll be chatting with the Mater Hospital's Stroke Service speech and language therapists, Rachel and Laura, where we will chat about post-stroke communication difficulties. We will provide tips and ideas on how to optimise your communication at home.
This podcast is for educational and entertainment purposes and does not contain personalised medical content or advice. Always speak to your GP or primary medical team regarding your own personalised advice and healthcare plan.
Rachel and Laura, welcome. You are both very welcome today, and thanks so much for joining us in the Stroke Matters podcast. Rachel, perhaps can you tell us a little bit about yourself and your experience as an SLT in the Mater, and perhaps what inspired you to be a stroke speech and language therapist?
Yeah, thank you for having us on. So I've been working as a speech and language therapist for 18 years. I decided to become a speech and language therapist after a close friend sustained a brain injury at the age of 17. And I was able to kind of see firsthand kind of the power of communication and how a speech and language therapist was able to unlock that. So he was unable to communicate verbally, unable to move his head, his hands. And a speech and language therapist came along with a very basic alphabet chart, and she was able to get him to blink when she was pointing to like the lines and the letters that he wanted to choose, and he was then able to spell out messages and make his needs known. So it was really powerful. Wow. So I wanted to become a speech and language therapist after that, and I've always worked in kind of stroke and brain injury.
Wow.
Yeah.
Wow, Rachel, that's definitely amazing that you got to see the impact that a speech and language therapist can have on someone with communication difficulties. So no wonder it inspired you to become a speech therapist. Laura, perhaps would you like to tell us a little bit about yourself and what inspired you to become a stroke speech and language therapist?
Sure. So I've been working as a speech therapist for about 5 years now. And I was quite passionate to go into the area of stroke rehab because I love working with patients and their families and really setting goals that are going to be very meaningful for the person, the quality of life benefits. And I think stroke is such a fabulous area for research and development. There's always new ideas coming through, new therapies and things to work on. So I just find it really rewarding.
Yeah, every day is a different day.
Every day is a different day. You never know what you're going to get in the stroke ward.
Yeah.
So yeah,
it's brilliant.
So Rachel, you were chatting to us there about how you were inspired to become a speech and language therapist. We know as Stroke Link nurses here, and you guys obviously as well, that there are many different types of communication issues that patients may experience after a stroke. Do you want to maybe tell us about some of those and your role in helping these patients?
Yeah, sure. So approximately a third of stroke survivors will experience some kind of communication impairment. So the most common would be aphasia, what's also known as dysphasia. The two terms are used kind of interchangeably. So about 30% of stroke survivors will experience aphasia in the acute stage. And it reduces down to kind of 12 to 18% at the 6-month mark. And it's quite common following a stroke in the left hemisphere of the brain. And the difficulties can be with understanding spoken language, which we call receptive aphasia, and being able to formulate spoken language. So that would be expressive aphasia, and difficulties with reading and writing as well. So quite common characteristics of aphasia would be kind of difficulty finding words, like using the incorrect words, and being limited to kind of single words, short phrases. And then motor speech disorders would be like another group of communication impairments, the most common being dysarthria. So that is caused by weakness of the muscles for speech, and it can result in like slurred speech, quite slow speech, maybe quiet, and can be difficult to understand, so like reduced intelligibility. So in dysarthria, the language is intact, but it's the speech production which is impaired. And then apraxia of speech is also a motor speech disorder, and that's where the person has difficulty planning and coordinating the movements for speech. So they might find that they're kind of making inconsistent speech errors, and they're having difficulty kind of getting started with words, lots of groping movements. And quite often, like automatic speech would be a lot better than spontaneous speech. And then there's also cognitive communication disorders. So that's where a patient may have difficulty with attention, concentration, and memory, and all of those things can have an impact on conversation. They might find it difficult to keep up and follow complex conversations. So they might have reduced awareness of an insight into the difficulties they're having, and have difficulty with kind of social communication.
Wow, there's a lot there, isn't there?
Yeah.
I guess, Laura, from a speech perspective, Rachel there told us many areas of speech that may be affected. Are there any exercises perhaps that somebody who's had a stroke can do once they get home from hospital to help them to improve their speech and build their confidence? Or are there any aids available to them that may help?
Yeah, so as Rachel explained, after a stroke, there's lots of different areas of people's communication that can be affected. And as a result of that, the different therapy tasks that people might be working on will be very different depending on whether they're presenting with a more aphasia language presentation or something like a dysarthria presentation that affects their speech. Two things that I think are really helpful and beneficial for patients when they come home from hospital is firstly, thinking about what's going to be most functional for the person to work on. So whether they are presenting with, a mild dysarthria or a more significant and severe aphasia, thinking about what's going to be the most beneficial goal for this person to achieve. So if this person wants to, say, get the bus again, to work on vocabulary that will quite specifically target things like getting a bus ticket, or if they want to be able to order a drink at their local cafe, practicing ordering that drink, or speaking on the phone, or saying I love you to a loved one. It's really about sitting down and identifying what's going to be the most meaningful for that person. And then the other thing that's really beneficial is repetition. I think people often don't realize how much repetition we actually need to relearn a particular word or phrase. And particularly with communication difficulties, someone might have a word one day and then the next day they might not be able to say it again. And that can be really frustrating for the person. So it's just to be mindful that, it's important to take your time with it and to really give yourself that time and space to give as much practice as it needs to learn that new word or phrase. And the third thing, which is probably more for the more severe aphasia presentations, is they often benefit from kind of that musical exposure as well. So if somebody is really struggling to get any words out verbally, having a bit of music on in the background can really help. As Rachel mentioned, it's the left hemisphere of the brain makes language really tricky, whereas the right hemisphere of the brain is really beneficial for music. And sometimes that can draw out those words for people, even if they are really struggling to say the most basic words or phrases. I had a lovely experience with a lady who her goal was that she really wanted to be able to say to her family that she loved them, or to be able to say, I love you. And no matter how many times we practiced that phrase over and over, she was still really struggling to get it out. And then one day we were doing a little bit of music therapy and we were playing the song, You Are My Sunshine. And when we got to the part, You'll Never Know, Dear, How Much I Love You, suddenly she was able to say, love you. And
wow.
it can be a really nice way to unlock those little words for people sometimes when they're otherwise really, really struggling. So those are, I suppose, top three things to think about would be, functional work, repetition and music.
That's really
That's
lovely. And I
brilliant.
think maybe for the benefit of our podcast listeners there who can't see us, I think everyone around the table here had a big smile over here when you were telling that story about that lovely patient that you had.
And it's amazing how music can be brought into it.
Yeah, I think
It's
it's
something positive.
absolutely. I've had lovely experiences as well working in the UK within an aphasia choir. So people who have really significant communication difficulties joining together to work on a song, and there's a lovely sense of community from it. So yeah, I think there's a lot to be said
Yeah.
for a bit of music therapy for communication difficulties. So there's also a lot of therapy apps that will be available as well, and those can be a really beneficial way to get your speech therapy exercise in while you're at home. In terms of the specific apps, it would really vary depending on what the individual's diagnosis is, again, whether it's aphasia, dysarthria or apraxia. So ideally have that conversation with your speech therapist about what level your communication is at and what might be most beneficial for you. Yeah, I think when someone comes home from hospital with a new communication difficulty, there is a lot of learning for both the person and their family in terms of how to navigate those changes. A resource I'd often direct families to is learning a bit about conversation partner training. And there's a really good resource called Better Conversations with Aphasia, which is available on the UCL website. And that goes through in a lot of detail and with really helpful tips and strategies, the kind of general pointers we would give for family members to support their loved one with aphasia. Some of the general strategies we tend to recommend is firstly having a think about what helps this individual, because communication difficulties can vary so significantly. Some people might benefit from things like having picture supports or pointing or writing down keywords. Everyone's really different, and it's important. We always say all communication is valid. It doesn't just have to be somebody saying their words. Any other adaptations like that are just as helpful to get the person, to help the person to get their message across. And some other general strategies that we might recommend are to make sure that the space that you're in, that there's no significant background noise or distractions. That if you don't understand what your loved one is saying, to let them know rather than, them thinking that they have got their message across, to give them that little nudge that actually, is there a different way to try and say it? Or could they use some of those supports like pictures or writing? And for the person themselves, if they are more of a mild to moderate level of difficulty, sometimes they can benefit from strategies like talking around the word, so giving extra information about a word. Like if they're trying to say something like cat, they might think of other related words like it's fluffy, it has a tail and whiskers, and it says meow, and all of those extra bits of information can help the person who's listening to understand what it is that they're talking about. Or thinking about a word that has the same meaning as well can be quite helpful for the person. So lots of general strategies that we can recommend to people to kind of try and reduce that frustration, because it's really normal that people feel very frustrated when they have any communication difficulty.
Rachel, many patients may not have a physical, visible disability after stroke, and members of the public may not be aware of a person's disability. How would you advise someone who has had this type of experience?
Yeah, you're right, Melissa. So communication impairments are very much kind of a hidden disability. I think as humans, we're very social creatures, and like so much of kind of quality of life and enjoyment is linked to kind of socializing with family, friends, being part of society. And unfortunately, people who experience communication difficulties can find themselves avoiding social situations and like not participating as much. So for example, if prior to their stroke, they were like very involved in a club or a choir, as Laura's mentioned, they may find themselves not wanting to kind of go to that for fear of kind of struggling to communicate, people not understanding the disability and not knowing how to support them, and they kind of fear like communication breakdowns. So yeah, and I think these challenges being invisible to the public can lead to misunderstanding, isolation, reduced access to support. So I think the first thing I'd say is it's really important for the person experiencing the communication difficulties to kind of have a comprehensive assessment with an SLT, in which kind of with input from like the patient and caregivers, be able to identify kind of what the deficits are, what their strengths are, the compensatory strategies that Laura mentioned that would be able to help them to avoid and kind of work through any communication breakdowns. So in therapy, like in speech and language therapy sessions, we would also kind of focus on like self-management, building confidence, community reintegration, and often like signposting people to peer support groups, group therapy. That's obviously all really beneficial. And then from kind of a practical point of view, we will quite often use like a little card, like a credit-sized card that explains that somebody has had a stroke, for example. And if they're, say, in a shop and they're struggling to communicate with the shopkeeper or whoever, they can hand over the card and it says, like, I've had a stroke, I have aphasia, I have difficulty with like this and this, and then strategies to kind of try and rebuild that. So it's not for everyone, but some people do find that that's kind of really reassuring in the event of a communication breakdown, that they can kind of rebuild that. And people do want to help, but I think a lot of people don't really understand communication difficulties and don't know how best to help. With that said, there are a lot of great resources online. So obviously we now have the StrokeLink website, which is fantastic, has lots of information. There's also videos on YouTube that have been created by speech and language therapists that give kind of lots of advice as well on how to communicate with people with, say, aphasia. But also in speech and language therapy sessions, we may focus on communication partner training, in which the SLT will work closely with friends, family members, caregivers, to educate them about the nature of the communication impairment and teach strategies. So obviously the family and friends are the people that the person with aphasia is communicating with kind of day in, day out. So it's really important that they are able to support as best they can.
That's really good. Lots of really great tips. I like the idea of the credit card.
Yeah, it's brilliant.
Type card that alerts people to the fact that they may need a little bit, maybe more time when they're at, as you say, the checkouts or whatever, and just to explain. And I know certainly, a lot of our patients, Lauren, who would have been quite social before their stroke, would really struggle with that aspect of getting back to, as you say, maybe it's just meeting friends or going back to the choir or whatever. And I think really what helps a lot of our patients is just, once the friends realise or, have the family member have explained to them, and a lot of our patients are really fearful about going back to previous groups and meetings and stuff. But once they do get back and see really that, people do want to help them. Yeah. It really, really helps them boost their confidence.
It motivates them, boosts confidence. I really like the card idea because it's something that seems so simple but can have a huge impact on someone's life. It can give them that confidence that there is that reassurance that they have that information to pass on to a shopkeeper or whoever they encounter.
That's it. It's all about rebuilding that confidence, isn't it?
Yeah, I think working with a psychologist as well can be really helpful. So like often doing like a hierarchical approach to things. So if somebody's extremely fearful of going back to a particular event, then you can identify kind of steps between kind of where they're at now and where they want to get to, and break it down into little manageable pieces. So that often works really well as well, and getting people back to doing things they enjoy.
And that's it. I think it's really important as well, especially if somebody's had a stroke, that they can, look at the progress that they have made. Progress very often isn't instant, but when they see maybe how they were 3 to 4 weeks ago compared to how they are now, and the gains that they've made and the progress that they've made and the confidence that they've built, that in itself is a real confidence boost for patients.
And motivator.
Yeah.
Laura, so many stroke survivors with speech impairments live independently at home, but many may worry about any difficulties that they may face in the event of an emergency. Do you have any safety tips or advice on what you would recommend?
Yeah, so ideally, if someone is going home with new communication difficulty, there'll be a bit of a risk assessment done within the hospital by the speech therapist and occupational therapist. So that'll be done prior to their discharge, where it's identified how this person would raise the alarm if anything were to go wrong when they're at home by themselves. And again, for some people, that might be making sure that they can navigate their phone to get in contact. If people have really significant and severe communication difficulties and are unable to navigate their phone, then other methods might be used, such as a pendant alarm, where they can simply kind of press a button and then emergency services will be alerted that this person needs help urgently. So those things should be done ideally ahead of time before someone gets into their own home.
I suppose a good tip for the pendant alarm is we would often recommend stroke survivors or patients to wear the pendant alarm around their neck rather than on say for example, their left arm, in case they had right arm weakness, they wouldn't be able to alert the button. So it's just another small little tip.
Yeah, exactly. Laura, a lot of our patients would suffer from a lot of fatigue or stress after a stroke, and certainly, fatigue and stress can both affect communication. What advice would you have for somebody who may be, struggling with stress and fatigue and have communication difficulties after stroke?
Yeah, so absolutely. It's very normal that people with communication difficulty might report that their communication is more impaired when they're tired, or else if they're feeling very emotional. So if they've had a really difficult day where they're very stressed about things, or maybe they're feeling a bit down about things, those are the days often where they find they have less success in getting their message across or getting their words out. So firstly, even just letting people know that that's really normal and that's to be expected. And secondly, we'd often recommend that people if you are feeling very fatigued, to take regular breaks, to be kind to yourself. If you're really trying to get a word out and it's just not coming, it's okay to just leave it, park it, move on to something different. And often it's when we move on to something different that, our brain kind of calms a little bit, and then we might have more success in finding it. So just being kind to ourselves. I believe there was a podcast done as well by our occupational therapy colleague who will focus on fatigue. So I'm sure there's some really great tips in that as well about general fatigue management, because when fatigue is managed generally, that'll positively impact on the communication side of things as well.
Great, thank you.
Great, that's brilliant. So lastly, we like to round up the podcast by asking all our guests the same question. So Rachel, I might come to you first. Rachel, what advice would you give to a stroke survivor or family member who is supporting someone who has had a stroke?
So I'd say that recovery from stroke is a journey, and to have patience and acknowledge that there will be good days and there will be bad days. Also, the healthcare professionals, like the nurses, the therapists, they're all there to help and support you. So it's really important that you're open and honest about the challenges that you're facing, so that they can offer you the help that you need and signpost you to services that can help. I guess to carers, I would just kind of stress that it's really important that they kind of take the time to understand the challenges, be there to support the person in the way that they need, which is obviously very individual to each person, and to work with the therapist and understanding the difficulties, taking on board strategies, and just like being there for them.
Yeah. Laura, ask you the same question. That's okay.
So I suppose something else that I'm often cognizant of is that there's lots of evidence that aphasia in particular can really impact people's mood when they come home from hospital, and people are quite prone to feeling both low mood and anxiety in their adjustment to their new life. So it's just being mindful of that, and I suppose availing of any therapy services that are available if necessary. There might be the opportunity to link in with a psychologist during your inpatient stay. But if you notice when you go home that these things are persisting, then maybe checking out the resources on the Heart Foundation website. I believe they have access to therapy services there. Or even check in with your GP and just letting them know the situation and seeing is there any support they can give from that mood side as well.
That's brilliant.
Really good tips and advice, yeah.
Yeah.
So Rachel and Laura, thank you both so much for chatting with myself and Lauren today. It's all been extremely insightful and really informative. And I know many stroke survivors and their families and many others indeed will find all this information extremely helpful. Yeah. So thank you both very much.
Thanks very much.
Thank you so much.
Thank you. This podcast was brought to you by StrokeLink. I'm Lauren McDunphy.
And I'm Melissa Gannon.
Make sure to follow our podcast series on Spotify, Apple Podcasts, or wherever you download your podcasts to learn about living well after a stroke.
If you like this podcast, please like and share it with family and friends. You can learn more on our dedicated website, strokelink.ie, where you will find an array of information and content written by stroke healthcare professionals, along with information on community supports and services. And always remember, stroke matters and you matter.
Stroke Link podcast was brought to you through the support at the Mater Hospital.